recording? Hopefully. Is it recording? Okay, I will enable transcription. I've never done that before, so fingers crossed. The things I don't even think of. But thank you to
I
whoever.
thought your hair was. I was like, "What the hell you got going on?" The speaker part was sticking out.
Okay.
No.
No.
Can everyone who joins make sure to mute, please?
Yeah.
Thank you. Okay. So yeah, I guess for now we can get started because we do have quite the itinerary ahead of us. So, oh my God. So, well, I can mute people, I know that, but I also somewhat don't know how to. Thank you, Destiny. Anyway, so hi everyone. If you haven't figured it out already, I'm Stella. I'm the host of this event. So welcome to the Asexuality in Psychology and Health Awareness and Depathologization seminar. Today, you're going to get to hear me and 4 other fantastic speakers from across the ACE spectrum speak on our work in the field of asexuality awareness. So there's going to be a question and answer session at the end. Please, I'm going to put the link to the form that you can use to type in questions because I cannot keep track of the Zoom chat realistically. So yeah, here I'm gonna be putting the link in throughout during every speaker. So if you do have questions, drop them in that, and that is what's going to be used for the question and answer at the end. So yeah, to start off, I guess I'm going to introduce a bit about my own work. So on top of the Aromantic Asexual Instagram page that I run with the focuses of the Canadian ASPEC experience and asexuality in health, I'm also involved in a lot of ACE-related research projects with the Researching for LGBTQ Health team of the Dalla Lana Faculty of Public Health here at U of T. And yeah, I'm supporting a PhD student in his work on an ACE-related research project, but also I'm writing a review paper on my own, which I'm hoping to submit soon, fingers crossed, titled Asexual Competent Practices in Healthcare. So basically just a brief summary of my findings because I really don't want to be a full speaker, but yeah, so some of the things that I learned through reading a lot of literature in this field is that there's a lot of ways through which health providers can improve care for asexual people, and these include being well educated on the entire asexual spectrum, avoiding pathologization, challenging the idea that sexual attraction is universal and imperative for good health, reacting affirmingly by listening without dismissing their clients or patients, accepting patient self-identification, connecting ACEs to their community, and tailoring care specifically to ACEs as opposed to just having general LGBTQIA+ approaches that treat everyone the same way. Then there's also institutional level things that can be done. So for example, providers can include inclusive language on intake forms, offer like asexual friendly survey questions. So for example, I know a lot of times with like mental health care, one of the things is like, oh, have you been like sexually active or experiencing like the same levels of desire? And that's not always like the most ACE friendly to start with. And then also in general, highlighting the ACE community on pamphlets and posters by using the full acronym LGBTQIA+, and not stopping at the T or the Q. And there's also like frameworks on institutional levels. So for example, when they should, like at a health educational level, there should be specificity to like specifically focus on ACE people or like individual populations as opposed to like entire broader communities. And also just health education as a whole should cover asexuality and incorporate it into the definition of sexual health. So as I mentioned before, not conflating healthiness with like good sexual activity or attraction, because that we know does not apply to everyone. Oh, I'm muffled because of my mask. How bad is it? Oh my God. I hope
It just became a bit worse a couple of seconds ago, even though you were in mask already. So probably something with the mic on the wire.
Oh, okay. I think the ruffling is my computer because I have a very old computer, and people have called it both a lawnmower and a vibrator as a joke before because my laptop is that bad. So also I'm
You're better
sorry.
now.
I'm better now?
Yeah, it became
Okay,
better.
perfect.
It might be the air. It might be the air actually restricting the bike. But it's fine now.
Okay, it's good. Anyway, yeah, so I was pretty much like, now there's a drill in here, I swear. Okay, so yeah, my last sentence was just that, yeah, like incorporating it into definitions of sexual health, so not conflating like health. So not conflating health with like the requirement of sexual attraction or activity. And yeah, that's basically the summary, not the speaker version, it's just my introducing the event version of sort of what I've been doing in like my review paper that I've been working on, and also just like reading and things that I've been interested, which sort of inspired me to run and plan this seminar. So yeah, I guess now I'll be, before I pass it off to our first actual speaker, I'm going to be doing a little bit of a poll. So hopefully you can see the poll. There's 3 questions. It's basically just like me collecting demographic information about who's in the audience, so I know more who to tailor future events like this to, like in the future. So you can, someone can like confirm you see the poll, right?
Yep.
Okay,
So we can see it.
So I'm just gonna give like 1 minute for that, but with tech issues, I already went kind of over. So, yeah, till like 1:08. Very, very interesting. I don't even know why I'm like getting competitive. Like I want the airways to be the biggest population, but I'm just doing it. Okay, this is very cool. I love demographics. Okay, I'm gonna end the poll. Hopefully everyone got a chance. It's not the end of the world if you didn't. I like download results. Let's go with that because otherwise I'm gonna. But anyway, so yeah. Now I'm gonna introduce our first speaker, who is Destinie Vidrio, an ace-identified trauma-focused therapist and adjunct faculty at Pepperdine University. They're currently working on a thesis related to asexuality as well. Please welcome them to the stage.
Hi, everyone. It's always awkward doing this because you're like talking to a screen with no noise, but hello, everyone. So yeah, my name is Destinie Vidrio. My pronouns are she, they, and I'm an associate therapist, also adjunct faculty at Pepperdine University and a doctorate student at Pacifica. And I wanted to talk about, as I saw in the poll, there were a lot more ACE identified. So I'm going to gear it a little towards also not just mental health stigma in the mental health field that a lot of ACE identified people go through, but for you who are ACE identified and want to find a therapist, like what would that look like and what can you do to make sure you're getting proper mental health care? So unfortunately, there is a lot of stigma around being ACE identified, particularly in the mental health field. Trigger warning for anyone as well. Feel free to check out if I say a stereotype or anything that's triggering. I want to be aware for that. But when it comes to mental health, there are unfortunately a lot of mental health therapists that still kind of have a negative stigma around what it means to be ACE identified, if they even heard the word asexual as an LGBTQ plus sexual orientation, identification, or an aromantic. I'm going to be talking through my own perspective being what it means to be an ACE identified therapist, and unfortunately the backlash I've had around that, and as well as the people in my community, the ACE community, clients that I've had, and things like that. So one of the big stigmas that unfortunately a lot, and I'm hopefully you haven't heard it, but you may have, is that there's something biologically wrong with us when we're ACE identified. And there are still mental health practitioners that approach the ACE identity through that lens. And for those who are, I believe Yana, you're a psychologist, in our human sexuality class, rarely do they ever go over the ACE identity. They usually go straight into sexual disorders. So when someone comes in saying I'm ACE, sometimes therapists will approach it to, okay, what's wrong with you? Not okay. It is an identity, as we all know, hopefully, if you're here. So what can happen is a lot of therapists will start, as Stella talked about, these really invasive sexual questions, you know, that what is your sexual desire? When did you last have sex? Which as therapists, we have to ask in general, because we need to do a biopsychosocial. So we need to know certain things like that. However, just because someone is ACE, a lot of people will automatically go to, oh, they must have been sexually abused. They're not happy. They're probably here to work on it. And that they can't have a healthy relationship, which is BS. Yes, someone who's ACE could have definitely gone through sexual trauma. But just like sexual trauma doesn't turn somebody straight, gay, or lesbian, doesn't mean that it also turns somebody ACE. When I work with clients who are questioning whether or not they are ACE and who've gone through sexual trauma, we just create open space for that. So we, you know, yeah, it's curious. Sexuality is on the spectrum, right? When it comes to the medical piece of it, could there be a sexual disorder with someone who's ACE? Yes, of course. Just like there can be a sexual disorder for someone who is straight, lesbian, gay, bisexual, and pansexual. I ask all my clients to go see a medical doctor because, as we know, your biology can affect your mental health. However, it does not mean that somebody who is ACE has a sexual disorder. If a client comes into your room and identifies as ACE and that's it, we don't need to focus on it. It's really that simple. Someone comes into my room and identifies as pan and they're secure in that identity. I don't focus on their pansexual identity. Just as when I go to a therapist, disclose I'm ACE, and I'm really okay with that, I have so many other things I want to focus on in therapy that I don't want to focus on my asexual identity. That's not something I need to really focus on in therapy. If someone comes in and they say, you know, I'm thinking I may be ACE, I'm thinking maybe aromantic, or someone comes in stating, you know, I'm not experiencing any sexual attraction, I don't know what's going on, then you may bring in some of the ACE things as well. I always provide the Invisible Orientation, or ACE, those two books, to clients who are questioning, because there can be some confusion, especially those who have gone through a sexual trauma around what that identity is. Again, I make space for both. It could be the trauma was so bad that they're done, and maybe they want to identify ACE now, that's fine, right? It just because we click a box doesn't mean we're permanently that identity forever. It's fluid. We can do, you know, we can change it if we want. And a lot of the ACE identified clients that I get are pretty secure in the knowledge of who they are. Sometimes I get questioning. That happens. I get questioning with all kinds of identities, but the ones who come and say, hey, I'm asexual, they've kind of done the research and everything themselves by that point, which any of us who are on the LGBTQ plus have kind of Googled, right, where ACE identity is the internet kind of orientation, but we've all kind of Googled, like, what does this mean? So unless they bring it up as an issue, I don't mess with it. Unfortunately, when I do work with a lot of clients who have trauma, who are ACE identified, there is still corrective rape happening, right? And if you haven't heard, corrective rape is someone who's forcing sex onto someone without consent to change because it's going to help change their identity. It can happen to multiple sexual identities, but it can happen within the ACE. What can also happen within the ACE community that is a little unique is because when they're still questioning, they don't know. And again, trigger warning, some of those in the ace community may force themselves to have sex with someone because it's what we're supposed to do to be in a healthy, happy romantic relationship, which can cause a lot of trauma. And then it can cause some other mental health like depression, anxiety when they're not enjoying it as they should. I work a lot with that because that's a whole other issue. It's not like flat out rape, but this can happen. It's kind of under that umbrella. And so it can cause sexual trauma. What can also happen is that they're willing to sacrifice parts of their comfortability to make their partner happy if they're allo or, straight, right? They experience sexual attraction, which can also create a lot of problems in the relationship, depression, anxiety, PTSD, trauma, things like that. So I do work a lot with that. Those are things to keep in mind if there are mental health professionals out there. Also keep in mind that somebody who's ace, another stigma, is that they can't be in a healthy, happy romantic relationship because they're not experiencing sexual or romantic feelings. Again, that's BS. Yes, they can. As when I work with couples, it's a lot of compromising. It's a lot of communication. It's understanding consent. I'm currently working with a couple who one's aromantic and one's asexual. That's fun, but it's working, right? It's working because we're working on communication, consent, boundaries, things like that. There's also, again, another kind of unique little factor is that there are still LGBTQIA, well, I'm going to do LGBTQ plus communities that don't think asexuality is part of that community. I remember when I was in college, the A in our Pride Center stood for ally. So I didn't have a space to go to while I was questioning this. There still can be some, and I've seen this mostly on social media, some backlit, oh, you're just a prude, you're straight and you just don't know who you are yet. Oh, you're just trying to put into the community because you want to feel like you belong somewhere. Oh, you never really like experience oppression because you're really just straight. Right. So how, it's only been fairly recently that ace has been known as an identity. And as I'm sure 1%, most likely more, because the more youth I work with, the more ace I'm meeting, are identifying as asexual. And there's still not a lot of information out there. That's why we're calling the internet oriented, because we Googled it a lot of the time. So finding a community and a support, as Stella said, which is huge, is hard because not all Pride centers are open to the A and LGBTQIA. So keeping that in mind when you're a mental health professional and you're trying to find support systems, doing research to make sure that this Pride center, this LGBTQ plus center is really open to the ace identity and know what they're talking about. As I say, it's not enough to be, as a therapist, LGBTQIA plus affirming. You must be LGBTQI plus knowledgeable. So for us who are aces looking for a therapist, this is the hard part. Psychologytoday.com does not even have a section for asexuality. I had to type mine in. So in order, how do I find a therapist? Because mental health people suck sometimes. I'm just gonna say that. Finding someone who puts not just lesbian and gay, but also bi, kink positive, open to polyamorous, maybe writes it down like I do on Psychology Today, kind of leans toward, okay, they may know more about this. I decided to come out as an ace therapist for that reason, mostly to show that, hey, I know what I'm talking about, kind of. I don't know everyone's experience, but I'm knowledgeable. There's inclusivetherapist.com, which actually has a section for asexuality. And I want to be very clear as a client, for someone looking for a mental health professional, you have the right to question your therapist. You have the right to ask them, have you worked with ace-identified people? Do you know what asexual aromantic means? Do you know the difference between a sexual orientation and romantic orientation? I mean, I get questions that are like, do you have children? So if they can ask that, you can ask these questions too. If for some reason they say something like, oh, there's something wrong with you. Oh, don't worry, we're gonna, you come out and they say, we're gonna fix that. Don't worry, we're gonna fix that. You have every right to drop that therapist. As I say, never sacrifice parts of yourself for the comfort of your own therapist. If your therapist isn't open to having that dialogue, they're not the right therapist. So it's okay. I get dropped for reasons like you didn't fix my child, so I get dropped as a therapist. Oh, you're not working fast enough. I get dropped as a therapist. So if a therapist is like, we're going to fix you, drop them. There are a lot more open therapists out now with telehealth. You know, within your state, you can find you're open to a lot more therapists than I think we were before COVID, where we thought we had to stay in this community. So if you need to be an advocate for yourself, be an advocate for yourself. If your therapist is open to having that dialogue, have that dialogue with them, but know that it's not your job to educate your therapist. They need to go do the research and education themselves, like attending things like this, going to, I know Aubrey's going to do a wonderful kind of thing for professionals, finding those places. We get credit for it. So like they can go do it. But it's not your job to educate them. And you can all say, hey, I'm Ace, that's it. Don't want to talk about it. Let them know. Because unfortunately, I don't know any other psychologists here who are getting like Psychology Today articles. They're starting to change, but there's still articles saying how being single is a mental health disorder. Which is a whole other BS thing, that there's still within the field some misconceptions, not a lot. What is ACE? It's starting to change. I'm going to be very open to that. It is starting to change. I am in the field. I'm seeing it. People are questioning it. But even as a ACE therapist, I have gotten from a supervisor, like, how can you possibly be a therapist if you don't understand what true intimacy is? Dropped that supervisor, but took me down for a while. All those kind of things. So as an ACE client, remember that you have power. You have a lot more power than we do as therapists, right? So never, ever, ever sacrifice who you are for your comfort of your therapist. Drop them. It's okay. We're therapists. We're trained supposedly to be okay with clients dropping us. It doesn't work, but that's kind of what, we need to be aware of that and make changes ourselves. So yeah, I think, did I hit my time? I wasn't paying attention. So thank you. All right.
Yeah, so thank you so much, Destiny, for that really insightful first presentation. To the audience members, just a reminder that the link to the questions, like the Q&A form, is in the chat. I've already been seeing a couple come in, so it does work, and that's how we'll be taking questions at the end. So yeah, now I'm going to introduce our second speaker. So our second speaker is Yana Vikulova, a practicing psychologist who is a happy allo partner of an ACE individual and focuses her work on counseling ACEs. So take it away.
Yes, hello everyone. Thank you for this introduction. Can everyone hear me? Okay, good. Actually, I'm trying to gather my thoughts to follow Destiny organically because, yes, there is a lot of stigma, and the thing that really sort of carries on from therapy into relationships is how can you be in one if you don't understand true intimacy, if we can't be intimate? And this is the misconception we get a lot. We allos tend to have it, that sex equals intimacy. We were brought up this way. This is how things are supposed to work, but in actuality, as an allo person myself, I can definitely say that it's not the only way we can be intimate, and even not the best one, despite what many people think before they enter a mixed relationship. So the problem of many ACEs that I come across in my work is they've had so much bad experience being rejected outright after coming out as on the spectrum, be it asexual or demi or other forms of gray, that it's easy to get disheartened, to believe that there is no one who would be able to love without sex, basically. And this is wrong, for one. So Destiny is working with mixed couples. I am in one, and a very happy one, and this was what actually moved me to start working with aces. The thing that I want to say today under this banner of depathologizing asexuality is that the same problems are being voiced by so many allo people. It's not just about being ace, it's just about being dumped for who you are. We now live in the culture of fast dating, these dating apps where you just swipe through people and sort of have this list like his or her nose is too big, the background is bad, whatever. Any minute thing can be the reason why you were swiped away, same as it can be the reason why you got dumped. We have this overabundance of choice, which makes it very difficult, not even to compromise, I wouldn't use this word, I mean to notice a person that can be practically perfect for you, but that takes some getting to know this person. And this is why whenever I talk to people, whenever I counsel aces, I don't recommend coming out right away, right at the very beginning, like, I don't know, first date thing, because it's much too easy for another person to overlook you because you have this special trait. And well, compare, there is a big difference. Understanding, realizing that a person you barely know has some very special trait that might require some adjustment on your part, or hearing about the same trait from a person who you know, who is your friend, and you're maybe even falling in love with this person. Big difference. I never recommend lying. I never recommend pretending to be allo, but neither do I recommend starting with coming out, because the other person needs time to get to know you and to understand that you are the person with whom they're ready to take steps to build this special, private, your own kind of intimacy. Once again, sex is far from the only way we can experience intimacy. And you may be the one for some person who would have otherwise overlooked you if you had come out on the first day. So consider this balance, when to come out, and what intimacy you can build with your possible future partner. It takes a lot of communication. We work through that in counseling, a lot of negotiating, I would even say. And for people who don't have a partner yet, who are maybe afraid of going into therapy because of some bad experience, but want to know how to improve their chances of a happy partnership, I do recommend finding the right therapist. Destiny gave some great tips on that. And another thing, exactly because asexuality isn't some pathology and it doesn't create anything unique. All couples go through difficulties. Yes, it's a specific kind of difficulty, but still the rules of most couples apply. Communication, trust, coping with emotions, negotiating different things, etc. So if you're not ready for therapy yet, you can benefit from some self-help books and books on managing couples, negotiations in a couple, things like this. Just make sure they are real, classic books that have shown their usefulness time and time again, as opposed to some one-day junk. And that can help if you read a lot, if you improve your communicative skills, your coping skills, emotion management skills. Chances are, at least higher chances, that you will be able to help not just yourself in a future relationship, you will be able to help your partner deal with their emotions and their difficulties when these complications arise. And working through difficulties can be a bonding moment, a moment of real intimacy, as opposed to sowing discord and having fights. So that's all I wanted to say on my part. Thank you for your attention.
And I think Stella was having some trouble with her sound. So I believe I'm next, yes? Okay, no? I don't know what that means.
Keep going.
You're good.
Okay. Hi, I am Aubrey Lancaster and I'm a sex educator. So I'm not a therapist, but I do work in that realm as far as education goes. I am a member of, well, I am working towards my certification with ASECT, which is the American Association of Sexuality Educators, Counselors, and Therapists. So I'm a member, but I have not gotten certified yet, but I have 16 years experience as a sex educator. And when I came to asexuality, I realized just how much is needed in the education realm on this subject. So I'm going to give you just a tiny little bite. Everybody is set up very nicely about these questions about intimacy, and that sex is not the only kind of intimacy. So what other kinds of intimacy are there? And that's what I want to talk a little bit about. We're going to talk about differentiating attractions. So we have this big ball of attractions and we think it's all one thing. But really, it's just a big ball of strings that are all intertwined. And when you start pulling apart those strings, you see that there is this beautiful spectrum of attraction and intimacy that's available to us. And so obviously we see the sexual attraction and we know about the romantic attraction, but there's also sensual attraction, which has to do with non-sexual physical touch. It can become sexual if that's where you want to take it, but it can also be in a non-sexual manner of cuddling and snuggling and leaning against each other, hand holding, just a touch, any sort of human connection. You hear people say that they've been kind of touch starved over lockdown, and that doesn't mean that they necessarily need sex. It means they need physical contact with other human beings. And maybe they also can get that kind of touch from a pet, family member. It doesn't have to be like I said, we're not going in that sexual direction with it. It is a non-sexual kind of attraction and intimacy. We also have aesthetic attraction. And aesthetics is not just the physical appearance, it's how you present yourself. It is the kind of fun we have with how we dress ourselves, how we dress our spaces, our homes, how you decorate, how you project your aesthetic of your person, and how you can appreciate the aesthetics of other people. So when you say you're drawn to somebody's aesthetic, rather than just talking about, hey, they got a nice butt, look at what it is that they have created in their person that you can appreciate with that, and how you are drawn to those kinds of things. There's all sorts of aesthetic themes: cottagecore, fairycore, e-boy was recommended to me. So there's lots of fun ways that you can enjoy aesthetics. So then we also have emotional attraction, sharing your feelings with somebody, having that deep emotional connection with another person, and how you can relate to other people, having somebody to support you, being a good listener to somebody, having somebody that you just know gets you on that deep emotional level. We have intellectual attraction. This is where you are just a meeting of the minds. It doesn't have to be about intelligence so much as it is about sharing your interests. How do you connect with somebody on an intellectual level? What interests do you share with them? Do you have a shared fandom? I'm in a Marvel, hi. And how are you able to talk about things that you want to conceptualize into words, and finding somebody else that shares that perspective and that interest, and being able to sit up all night talking about these things with them, and having that kind of a human connection with another person can be really intimate in and of itself. And then we have something that isn't talked about very much in ACE circles, and I think it needs to be talked about more: spiritual attraction. Finding somebody that you connect with on a spiritual level. We all have different spiritual leanings. So even if your partner isn't necessarily on the same page spiritually with you, you can find people who are. You can find people to have that spiritual connection with, and have those discussions and talk about the universe and your gods and whatever it is that helps you to feel that connection to spirit and wholeness. So that's another kind of attraction that is available. And social attraction. Like as far as just wanting to go hang out with people, or having somebody that you want to be social with, and where do you want to go together, going on adventures together, going enjoying a sport together, go hiking together, or go to a theme park of some kind together. What are the things that you like to do for entertainment and relaxation and recreation, and finding somebody else that shares that passion with you. So these are all different kinds of attractions we can have to other people, and all different kinds of intimacy. Dr. Marilyn Volker out of Florida had a very parallel concept of intimacy that she worked on, and I found it fascinating how much it paralleled a lot of the concepts of attraction that come up within the asexual and aromantic communities. So when somebody says, well, what's left if you don't have sex? Oh my God, there's everything. There's the entire experience of humanity and connection. So how do you focus on just sex when there's so much more to connect and love with each other? And when you take the hierarchical perspective of love and romance being the ultimate, and you bring platonic connections into that, and it creates this vast array of ways that we can be human and be with other people and have intimacy and have connections, and not rely on one person to meet all of our needs. So that's what I have to offer today. So where do we go? Is that Dr. Chasen?
I'm up next. Yes, not actually Dr. Chasen yet. Very close to finishing my PhD and had to take a break for a while due to some health issues. Hopefully, we'll be completing that soon. Basically, I just have to finish writing my dissertation. But yes. So I'm going to be speaking to. My name is CJ. I have been a very long time ACE community member. I'm Arrow Ace, and I'm old enough that back when I sort of made connection to the ACE community back in, I don't know, was it, I think early 2005, there was room for aromanticism to be part of asexuality in ways that these things are now being shoved apart, often violently. And for me, those things go together, and they don't for everybody. For me, they do. My aromanticism is part of my aceness, and I'm Arrow Ace. Like, anyway, so that's sort of the perspective that I'm coming from. And I've seen so many changes in, community. The first time that we marched in the Toronto Pride Parade, that was, I think, 2010. We had really, really powerful negative reactions to that. People in the parade were telling us to go get our sexual orientations cured. We had people who were happier to see the conservative parties had like a couple of MPPs marching or something, I don't remember. And they were happier to see the one, who were, and this was it's like, that's great, but your party doesn't support us. And they were happier to see that group than they were to see us. We got booed, we got catcalled. It was not fun. And I have seen that change over the course of the years as we have gone. And now it's one or two people who are saying like, you don't look asexual, or like, you're like, that's terrible, that's you're against it. Like, well, we're not here to stop everybody from having sex. That is not what we're here for. And so a lot of the misunderstanding and a lot of the education, and I still find people who find me afterwards who say that they were having lots and lots of sex that they didn't want, and they didn't realize that they could say no until they saw us there. And so some of these issues to me are very, very much interconnected with consent. And I'd like to pick up on some of the things in particular that various, you don't look asexual. What does that look like? And so a lot of issues. I also write academically about asexuality and some of the issues with, I started writing back to some of the academics that I felt were sort of missing parts of the picture. And there are now a number of ace-identified scholars and grad students writing, and that's a wonderful, so I've seen the changes. And I've also seen the swinging and the pushing back, and there's a lot of hostility, particularly online now, that I'm not necessarily seeing in a lot of in-person spaces. So back in, 2005, when I was sort of figuring things out, the local LGBTQ center, like on campus, I walked up there and they met me at the door, wouldn't even let me come in because they don't look like I belong. I don't think that would happen if I walked in there looking like this, though. The ways that people present are a little bit different, but things have changed so drastically. And I've been done presentations with youth groups where there are ACE people, ACE facilitators, it's just, and recognizing sort of the trans ACE and non-binary overlap, and the bi and pan in ACE overlap, and Arrow people who aren't necessarily ACE as well. So we're seeing a lot of interesting things. Sorry, I'm a little bit trying to reorganize what I'm saying so that not to right. So I'd like to pick off where some of you were starting, that sort of the assumption that being ace is necessarily wrong or something to be fixed, or that not having sex is something necessary, or not wanting to have sex is something that necessarily wrong or having to be fixed, or that limits intimacy. And Aubrey was talking about the different kinds of attraction and the different kinds of ways of doing intimacy, and deprioritizing. Like we talk about different hierarchies. So we have long words that are sometimes fun to say, like amatonormativity of prioritizing romantic relationships that are assumed based on sex, and that we're, oh, hello, Kat, sorry. I have a cat joining us here today. And these things, and so absolutely, we have a lot of really powerful assumptions that limit what we think is possible and what we think we can agree to or say no to or want or explore. And I like to think about consent, not necessarily just as a yes/no situation, because yeah, absolutely, there are sometimes, let me back up, but consent is willingly and freely agreeing to things. And there are situations that are very clearly we are not agreeing, or we're agreeing because we're being coerced into it. And that is very clearly not consensual. That's not consent. And then there's some times when we're super into it. We have all the options that we can take any of the options and we're super into it. Great. So there are situations where it is that clear, but freely agreeing to something. Well, what does that mean? There are degrees of freedom and degrees of coercion and pressures. And sometimes it doesn't always come from the person that is standing next to us with that. It comes from a lot of the societal level expectations of what we think we're supposed to do in certain situations or generally at all. And that can limit how freely we're making these choices. So I like to talk about how consensual something is. And these kinds of expectations limit or restrict or compromise consent. And so some of this, particularly a lot of these expectations, we have this idea that people are supposed to do romantic relationships that are supposed to be, presume sex the basis of marriage. And that's culturally specific. Romance is not always the basis of marriage in every culture or throughout history, but where I am living, and I'm coming to you from Toronto, and we'll get into a little bit more, like that is the name that we are using in a particular cultural, it's a colonial, well, also anti-Toronto, like there are different languages of what that can mean. But yeah, then this idea, we very much have a society organized around couple units, even if it's not necessarily around marriage anymore, it's still very much around couple units. And that very strongly limits what people can explore. And so as somebody, I don't do romance and I don't couple. What does that mean for my relationships? That puts a lot of restrictions and pressure, and I'm having to do a lot of work to explain how I'm pursuing very different relationships with people and the expectations that our people are bringing to that. And that presents a lot of challenges. And mostly other kinds of things that I'm talking about, because it's more in line with the topic of the seminar today, there are expectations about what's happening in romantic relationships. And because that's often where a lot of some of the more like pathologizing happens, because I can often avoid the pathologizing, like, well, I can and I can't. As soon as I go to a doctor, I'm constantly asked for a lot of chronic health issues. I'm constantly asked issues about sex life and sex drive, and I have to do a lot of explaining. No, not at all. No, this is not a change. No, this is not a symptom. And it can be for some people, it's not for others, and so on, and blah, 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 blah. And here's just to access healthcare that has absolutely nothing to do with this. So it is something that I can't completely avoid. But for the most part, I'm not looking to try and I'm not looking to fit into the couple mold. So I'm in some ways free from the expectations placed on that. But a lot of people aren't. So a lot of people who are looking to participate in romantic relationships or sexual relationships, or even non-romantic couple like partnerships that are still sort of fit into coupledom, we have this idea, and Aubrey was certainly mentioning like the idea that people are, I think, that you like, and I think several of the other speakers as well, that this idea that your partner is supposed to meet all your needs, and we need to break free from that. Absolutely. And we have this idea that within a romantic or presumed sexual relationship, or even backing up, we have very gendered ideas that women want romance and commitment, and sex is the price that they pay for, and all of these really dangerous, which have no basis in like that. They're not real. They're not, I mean, they're real insofar as people are, these expectations have consequences, but they're not based in anything. And so like we have these, so we have gendered expectations, but on top of that, we have other expectations that there is like a right way for these relationships to look, the right and legitimate way, which is sort of the proper, morally upstanding way. And that's sort of usually the monogamous, but at least even there's some room for like poly, as long as the couples look sort of normal and they involve like romantic connections, one-on-one. There's sex, eventually some kind of sexual interaction. It might not be before marriage or before commitment or before a certain point, but eventually, yes, you can say no on a particular occasion, but eventually it's supposed to include these components. And that these components are not necessarily supposed to be taking place in other kinds of relationships either. And these are very, very powerful ideas that have historically and continue to be used to uphold racial hierarchies and justify racial violence. Like if you think of some of the justifications for a lot of the colonial violence that we have experienced and continue to experience today, this is based on teaching people the right way, the morally upstanding way to, like, these were some of the justifications. And we see these consequences continue to play out with racial and gendered, simultaneously racialized and gendered stereotypes of how people are sexualized and hypersexualized and desexualized, often simultaneously as objects and not necessarily as subjects in the world. So when people are facing these expectations, they don't play out the same for everybody. And when we talk about compulsory sexuality, it's not you must have sex, it's the you must do the socially appropriate for you sexuality. And what does that look like? That's going to depend on all of these factors: age, gender, ability. Race is a really, really big one. And there are often conflicting expectations and people are in no-win situations. So a lot of these pressures are coming and but some of the really big ones that are in a romantic relationship, that basically sex is the price that somebody who doesn't want to have sex pays in exchange for the other person who does being willing to have that relationship or that commitment. And that's a very, very damaging and destructive assumption. It's based on the idea that it is fundamentally better or normal to want to have sexual interactions, or to not be asexual than it is to not want to have these things, whether or not you're asexual. And sometimes there's some of the language around that is it's okay to you're expected to have sex, maybe not if your partner is asexual, then it might not be a fair expectation, but it is otherwise. It's like, well, that doesn't even make any sense. And it should be okay for anybody, regardless of how they identify, to not want to have sex. It should be like, you have to be able to say no to have the space to say yes. Consent is about, you need both of those things. You need to be able to say yes, and you need to be able to say no, and you need to be able to do those very similarly. And some people talk about compromise sex, which I think is a disaster of a topic. And that's something that I'm glad that we haven't really talked about in this idea. But the idea of sex and sexual interaction with somebody is something that needs consent, but not having sex is not. Like, I am actively not having sex with you, Aubrey, right now, and I don't need your consent for that. I get to decide that all on my own. And I'm going to do that next Thursday too, right? And I don't need anybody's permission for that. I don't need your permission for that. So it's very, very different. But to have sex or sexual interaction with someone, you absolutely need their consent. And often people are up there and with me there, and then and then they might say, "But we're not dating." It's like, yeah, and why does that matter? That only matters because we have these set up expectations of that within a romantic relationship in particular, that there is an obligation and an entitlement that partners are to have sex with each other, or to fulfill those obligations or wants or desires if any partner wants those. And that's a really, really dangerous part to start from. If you're going to be negotiating like the Ace-allo things, as other people have been talking about, or whether, regardless of identity, if you're going to be negotiating a situation where one person wants sex and another person doesn't, or wants more than the other, you have to start from a point where what one person, like wanting sex and not wanting sex, are equally valid things. One is not better than the other. One is not. Anyway, so one is not more whatever. Both of them are really okay. And these things are very difficult to get to because they're not necessarily things that people are saying explicit. They're things that people have internalized. They're things that we as ace folks might carry, where we as people who don't necessarily want to have sex will carry. And so there's a lot of, absolutely, as Destiny was talking about, people forcing themselves to have sex. It's not necessarily pressure coming from a partner. It can be, and that's a major problem. That's straight up sexual coercion. But even when a partner is saying, you don't have to do this, I'm not expecting you, the weight of these cultural expectations is there and is powerful and is limiting our possibilities for consent, even in those moments. So it's less consensual these are still in operation. So yeah, so with that, I'm wanting to sort of, I think, highlight the importance of pushing back against all of those expectations in all of the different ways, and we will never be free of them. And as I said, these things, particularly where I am, are tied in with systems of colonization, of white supremacy, of large ableism, of classes, a lot of these higher structures. So they're woven into the fabric of society. So it's not a matter of saying, well, I reject that, and then it doesn't have any power. It's a constant ongoing resistance that all like trying to resist all of these things simultaneously, but it absolutely, we can make progress on that. And yes. All right. I think I'm talking more than I should. Thank you.
Still having trouble? Yeah, okay. So Stella had the list of questions for us, and let me pull that up here. So I guess I could run through the questions and throw them out for our panel here. Okay. Hi, I'm your new moderator. Okay, so the first question, do you find a correlation between ace-allo relationships and polyamory? So I'd love to jump on this and then I'll let somebody else throw in there. Polyamory is a relationship model as much as it is an identity for people. So the idea that heteronormativity and mononormativity are the only answers is really a social construct. So the idea of polyamory is just as much a social construct. So correlations, I mean, they're all having to do with each other in the sense of the constructs that we're dealing around sex. But anyone else want to throw on this one?
Yeah.
Yes, if I'm okay, you go first.
Oh, sure. I mean, I get a lot of clients who are ace who've questioned if they wanted to enter a polyamorous relationship. I think there's a lot of miseducation on what a polyamorous relationship looks like. So an ace arrow might actually pressure themselves, say, oh, it's okay to have another partner when they really don't want them to have another partner. However, there are very healthy polyamorous relationships that do contain and do not contain sex, depending on what the negotiation, the consent, and all that was. I think it's really, really reflecting on is this, because I get it a lot where there's people questioning and they're like, okay, he can go see other people. That's just what I get in the therapy room. He can do that because I want to make paths, I'm not into sex, but they really don't want to enter a polyamorous relationship. And I think that has to do with the like CJ was talking about, like this need that we have to have sex to be in a relationship, and if I can't provide it, let's bring somebody else who can. And I actually have a colleague who wrote their dissertation on jealousy and polyamory and all this thing. But I think it's really understanding and really educating yourself on a polyamorous relationship, reflecting that's something you really want, because you can have a very healthy monogamous relationship as an ace arrow identified person before jumping into that. That being said, I work with a lot of people who are very healthy polyamorous relationships as well. So,
Yana.
I agree. And basically what I wanted to say that using polyamory as sort of a band-aid for an ace-allo relationship that isn't really working out is a horrible idea. From my experience, it makes things a lot worse, because instead of fixing something, it creates a whole lot of misunderstandings, jealousy, issues, basically. So unfortunately, yes, there seems to be a correlation where people are forcing themselves into a polyamorous relationship with big quotes, but in general, it doesn't work. It creates a whole lot of problem. And if you're not polyamorous or poly-friendly, I love this term. I'm not poly myself, my partner is, I'm totally okay with that. So I called myself poly-friendly, unless you're that in your heart, not taking into account the sexual part of thing, I don't think polyamory is a good idea.
Just to throw one more level on that, if everything else in your relationship is going great and the sexual aspect is the only issue you've got, and you want to maintain that happy relationship and you want to open your relationship so that your partner can get access to sexual intimacy that they've been wanting that doesn't require you to be involved in, I think that can be absolutely beautiful. But yes, it's not a fix. It's not going to fix all the other problems you have in your relationship. So if everything else is great, it may be a great option to explore.
And I wanted to have the clients who I work with don't really know what polyamorous really means when they're jumping. They go in for, but like I said, those who come in who are very committed, like polyamorous relationship, it's just like I said with Ace, like they're usually good. I mean, they have couple issues, like I think any couple has, but they usually don't need me to like educate them or do it, like, because they're already, you know, they did their own research, and just like any other identity comes in and they're very strong. But yeah, I mean, I would be fine with it because I've reflected, I self-reflected, I did my own research. I'm very open to like the BDSM, like I'm kink positive too, which I think we need to incorporate that a little bit more into our everyday relationships. But that really, when you're thinking about that, really reflect, where is this coming from? Is it coming from a place of fear, or is it coming because I want, you know, I think I'm okay with that. You know, and don't just jump into it, especially if your partner recommends it and you just jump along with it, because that can happen too.
Yeah.
Also, just to clarify, to answer the actual question though, which I don't believe had anything to do with people specifically in romantic relationships, just general aces and polyamory. Yes, actually, there are reasons why a lot of aces are exploring all different ways of doing relationships, not as an attempt to fix an established relationship where there's a mismatch of what people want, but just as a way of, let's start from scratch. And polyamory, unfortunately to me, is still focused on romantic and sexual forms of intimacy. And there's a lot of ways of exploring intimacy outside of that. So polyamory doesn't really have anything for me, but a more politicized relationship anarchy, absolutely, as a way of exploring and deconstructing all of the lot of harmful forms of coercion in relationships. And so, yeah, there's actually a lot within a lot of ace and aro, but even ace who are not necessarily aro, or exploring non-normative relationships that are not guided by any ideas of monogamy. Yes, not as a fix for a particular couple relationship, but just as a way of, from the ground up, moving forward. And we have a lot of language that came from the ace community first, like queer platonic, although the language of that has been, there's a whole other politic around how that's being used now. And I don't even find it useful anymore because it's changed and been taken to anyway. But yeah, so from the ground up, yes, I do think, just sort of empirically from what I see on the ground, yes, there's a lot of that. But there's a lot of everything in the ace community.
Okay, Stella, we've got a bunch more questions, but we are at time. Are we calling it, or do you want to keep going? Keep going, okay. I have had sex twice in my life and have not enjoyed it. However, sometime I want to try it at the same time. Not want to try it. I am confused if this is being asexual. So I'll just say right now, asexuality is about attraction, not action. You are absolutely welcome to explore your sexual pleasures however you wish. Whether or not you actually want to do that, I think, is a question you need to ask yourself, or is it coming from compulsory sexuality? Anyone else?
I'm gonna just throw it out there. It's okay. Like, there are a lot of aces who are perfectly fine masturbating to get their sexual pleasure and not entering a relationship. That's also an option. Again, asexuality is an identity. It's not a libido. We have biology functions. We may feel arousal even though we're not attracted to somebody. But if it's consensual, like that good old consent, like that enthusiastic yes, and you can stop at any time. I'm going to put that out there. You can stop at any time. Right. So if you're like, okay, I'm going to try this, I'm open, and it's like, nope, stop, and find a safe partner. I think communicating throughout to do that with as well, who would respect that boundary.
Yana, CJ, you good? Or more?
Just a short addition that basically the question one needs to ask themselves is, do they want sexual relief or do they want sex with other person? So if it's the latter, yes, I agree with Destiny. If it's the former, then masturbation is great.
And you also don't need to come to a decision about that right away. You can wait until you are sure or have a better idea of what you want. And there are a lot of different kinds of sexual interaction that aren't the sex, whatever that means. And so like explore 36% of the sex, like any, like interactions can be sexual in a lot of different ways, and even interactions that don't necessarily involve any genital contact where people are fully clothed can feel like a hug can feel sexual or not. So there's a much broader thing. And also, just in response to Aubrey, yes, attraction, not action, but also there are a lot of different reasons why people come to an ace identity. And for some, it is about not wanting to have sex. Like being ace is, yeah, it's not about not wanting to have sex, except when it's about not wanting to have sex, which is sometimes the case. Like
asexuality as an orientation is about attraction. Asexuality as an identity is an umbrella term that gives space and community to people, including those who may come to it from not wanting sex.
Also, if you identify as ace, you identify as ace. I'm just gonna put that out there. If you're like, yeah, this fits, this is who I am, because there are what we call ace positive or ace, those who identify ace who enjoy sex, but they're not experiencing sexual attraction, they're still ace. So don't make anyone like make you feel less than because you're not fitting, again, a binary box that people try to put on the ace identity, because that's just not how it works. If you're ace, you're ace.
Okay, what is the best way to explain asexuality as a sexual orientation to my psychotherapist who conceives it as being pathological? Get a new psychotherapist.
Second, that it's okay to get a new psychotherapist. If they're not open to having that dialogue, you can literally bring in like the definition, like you can print it out, bring in a book, and they're still pathologizing it. Like I said, never, I'm gonna just keep saying it, never sacrifice who you are for the comfort of your own therapist. You shouldn't have to prove anything to your therapist. So you can get a new one. Inclusivetherapist.com is great. If you're in California, hi, my name is Destiny. You can find me on my Instagram page. But there are ace, not all, there are ace identified therapists out there, and there are those who are ace, knowledgeable. Again, I say knowledgeable, not affirming, because affirming, there's a lot of therapists checking that box because they feel like they need to, and they're not knowledgeable.
And if you still want to do some education for this therapist, like even if like choose to leave them as a client, but you still want to, there are a lot of resources that you can, like, usually having something to print off or email, depending on physically give them or send them. And there's a lot of academic scholarship now saying that this is a valid orientation that can really help. Because sometimes that's what they're willing to listen to, and they're less willing to listen to community sources. And so I appreciate the educational work you're doing, even if it's not going to benefit you, it will hopefully benefit someone down the road.
Yeah, tap.org, asexuality.org, aromanticism.org, acesandarrows.org, Ace by Angela Chen. Any of the research you were saying, yes, there's so much. They just have to type in asexuality in one of their research journal article searches and they'll find stuff. Okay, next question. Can we talk about that identifying as asexual does not necessarily exclude having and enjoying sex under certain circumstances, as in sex favorable aces, which is definitely one of my areas in sex education, and the fact that sexual attraction is a mechanism of arousal. It is not the only mechanism of arousal. And there are other ways you can activate human arousal. There's touch, there can still be visual stimuli, internal stimuli, just thinking about building arousal within your body. There could be accessories, toys, enhancement creams, lubes. There's a lot of ways to create sexual arousal beyond attraction. But anyone else?
I work with a lot of ace positive, ace or ace favorable or sex favorable, sorry. And again, it's just communication and consent as well. I mean, libido doesn't have to do with our attraction, right? Because I also work with a lot of mostly men who have freakouts because they're straight, but they're feeling some sexual arousal to other men. Well, that's a libido thing, not a sexual orientation thing, and kind of have to do education there. But again, libido is different from our attraction. We can be sexually aroused to myriad of things. And I work with, I see this a lot as a trauma therapist, right? With some things that they find that aren't okay because of their trauma. And that has to do with biology and not so much our attraction. But yeah, like I said, you're ace. Just because you're ace doesn't mean you have to hate sex. And I think that's a stereotype and a misconception that people give us as the ace, that we're prudes, that we don't like sex, that, you know, we're virgins forever. That's not true, right? So again, you're ace.
I mean, it's sometimes true, right? Like, we're an extraordinarily diverse community, and
Yeah.
like the numbers in the survey were about evenly split. The majority of aces are either, you know, sex averse or repulsed or indifferent. And there are some, absolutely. It's a fairly small proportion of aces, but among those who are grays and demis, it's actually quite a significant proportion. So statistically, but it doesn't really matter statistically. We're all here. We're all different. We're all here. Yeah, and we're all valid.
Okay. I've been questioning if I'm asexual biromantic for a while, and I think something that's been confusing me is differentiating between libido/sex drive and sexual attraction, or even other types of attraction like aesthetic. Do you have any advice for people who are in this type of situation and questioning? I mean, we kind of just talked about it now, but if you want to learn more about arousal, then I would recommend Come As You Are by Emily Nagoski. Anyone else?
Well, I also usually recommend that people don't get upset if they can't figure out the right label for themselves, because labels are like boxes. It's been said a million times, but still, we don't fit neatly into labels. You are who you are, and you don't have to decide that for your whole life to come. You can be asexual biromantic today, you can be gray sexual tomorrow, and so on. It's all very fluid and very diverse. Once again, so diverse that we really don't fit into boxes. If they are limiting you, confusing you instead of helping you, remember that you can drop labels at any moment. Just be yourself, and you can use simple, direct words instead of labels to describe who you are. I like this, I want that, I like men and women in this and that way.
Jumping off that, labels are what helps our brain categorize things for our own comfort of like the ego. I can go into a whole depth thing. It's just a word at the end of the day. It kind of helps. If it doesn't empower you, it's making you feel worse, then you like, you honestly, you can drop it. But I'm gonna, you know, what I say to most of my clients, young, you know, my adolescents and people who are all kind of discovering, because they were told they had to be something for their whole life, and now they're kind of coming to, maybe I am ace, maybe I am a lesbian because I, you know, I get the mired, is finding a safe partner to explore or discover your own body first. You know, be curious, read, you know, talk, you know, like do it in a way that's safe for whatever that looks like for you. But it's okay to be curious. Just because you check a box one day doesn't mean you're stuck with that label for your whole life. Sexuality and gender identity, they're all fluid. Okay? It's a fluid thing, it can change. And I work with a lot of people who in the like who've had trauma, who are like, no, I must be a lesbian because this, but it maybe had to do with their trauma, but now they're ace or pan or whatever identity they choose. But if it is causing you more stress, drop it for now and just explore and be curious. And then when you feel more comfortable, you can come back to that. Right. Because, but, you know, I get the story when it comes to like, you know, a lot of like, for me, I thought I was a lesbian first, because that's kind of where we go to, because we're kind of told straight, gay, lesbian, and everything else gets like lost. And then I was like, nope, not attracted to women either. What am I? And then I Googled, and then I found The Invisible Orientation, which is, I think, a beginning book for a lot of people in the ace identity. But that's where I started, right? So it's okay to explore, it's okay to change labels, you're not stuck with it. Finding a therapist or someone who can help explore it with you is always great as well. To kind of where you can talk about these things, they're someone that's a safe space.
Okay, CJ, can you speak more about the difference in discourse about asexuality being associated with aromanticism in 2005 and now?
Okay. briefly, in 2005, there wasn't anything as a not specifically ace, aromantic anything. The asexual community created the language of aromanticism and made it possible for many years down the road for there to be a not specifically ace, aromantic community to form. And so back in 2005, we were still figuring out language to even talk about like non-sexual romantic relationships. Like that was even still relatively new, and we had like Ace of Hearts and Ace of Spades as sort of old school sort of things, even before we were using the word ace, even before we had the language of gray, even before we had all of these things. And it was, there were a lot of us who were, there were just different flavors of asexual. Some of us were like romantically inclined and some weren't, and we didn't even have the language for that necessarily, and we just like, this was part of the diversity in the community. And for a lot of us, it was framed as just, this is the way I'm asexual, this is the way I'm asexual. We're asexual in different ways and we're all asexual. And for some people, like as Aubrey has talked about, experience like attraction as people can experience attractions differently. People can like experience attractions either parallel or not, but they may or may not be related. And for some people, the attractions actually, like, these things don't separate neatly into boxes. And that's sort of when we, the language of the different kinds of attractions doesn't mean that everybody has 14 different orientations and one for each. Like that's a nightmare version of what, that was never what this was meant to be. It's attraction is like a really amorphous area. So the ways that people can experience them, sometimes experientially, these things go together and are part of each other, or like they can't be separated. Sometimes they can be separated and you experience both or neither or one or just the other. And there just wasn't this pressure to separate everything out, and there weren't ways of separating them out. And then a lot of the separation that we see now has to do with the emergence, partly the emergence of the not specifically ace-aro community. And we see, like, we now have hit a point where we can see ace assimilation and even aro assimilation, ways of being normal. We're just like everybody else, but those kinds of, we didn't have that language. Nobody believed us anyway, so we had no stake in trying to be normal. And things have shifted, like, for like changed like drastically over these years. And so within that, there's also been a rise in the push to like the ace assimilationism. Some of it has been very aerophobic of, look, we're just like everybody else. Look, we can still do these romantic relation partnerships, monogamous partnerships, just like everybody else. They might look a little bit different. And then that's, well, what about the aces who don't want to date? And so that has pushed a lot of aces away from the ace community and sort of more into the aro community. And the aro community, there's also pushback of like, we're not ace, and separating that because there's the assumption that aro folks are only going to be ace. And while we're a huge, like aros are a huge portion of the ace community, maybe about 40% according to current, you know, like community numbers, but I don't know how accurate those are statistically. So like our base, like proportions are like, proportionally we're a much larger percent of the like ace community, given how few aces are in the rest of the population. Even the rest of the population is a much smaller proportion of aros, they still outnumber us. There are more non-ace aros than there are ace aros, aro aces, just because there are so few aces to begin with. So that has sort of been the shift of how that has gone along. And so the distinction is, sometimes it's about how people experience these things personally, but a lot of it, I think, is how people are responding to the political context of the assimilationism and the resistance against that, and figuring out sort of what community spaces they make most sense in, and whether they're caught between two different communities, and whether those things represent different aspects of themselves.
This is why I lean on the term differentiating rather than separating, because you can differentiate and see the differences without disentangling them and separating them completely. So it's like looking at that ball of yarn and being able to see the different colors in it, but also to see how they're still intertwined. Okay, what could be reasons, possible hypotheses for being asexual, not being able to experience sexual attraction, psychologically and or physiologically speaking? So what causes asexuality, basically? what causes sexual orientation has been a question for decades now, and they still don't have a very good answer, even though they have biomarkers and such like that. But anyone want to speak on that?
I just want to say that I'm definitely not going to get into that exactly because it's been disputed for decades and going one way or the other. actually does nothing to benefit the person themselves, because when I work with my clients, not just ACE clients, any clients that ask me like, why has this happened? I see part of my work in refocusing them on how to live happily with it, be comfortable with it, confident with it, etc., instead of why that has happened. Because one of my teachers gave me a beautiful metaphor. The question, why did you fall into a ditch, for example, does nothing to help you get out of it or fix your injuries. Two completely separate issues.
I mean, we need it. That's where sometimes the pathology comes. It's kind of asking like, what made me gay, right? I get this question a lot because I work with a lot of sexual trauma. So I get, did my sexual trauma make me ace? I don't know. That's kind of how I ask. I don't know. And then we delve into what's going on there, what's the importance that, and we do our work around that. I mean, for me personally, I made up crushes. Like I pretended to have crushes in elementary school because everyone was supposed to like this boy. And I'm like, oh yeah, I do too. Looking back on it, I've never had a crush, never. And people don't understand that because they're like, what do you mean you never had I've never had a crush. I'm also like Ace-allo. And now I'm like, okay, yeah, that's cool. I have other things to worry about. But so I was, like they say, the cliche, I was born that way. But that is, I get that question with clients because there's the anxiety and the idea that because we're not experiencing sexual attraction, there must be something wrong with us. And so we work on that and the anxiety around that. But because I do work a lot with sexual trauma, I get that question a lot. But I don't know. That's what I say. I don't know. I can't know someone's experience. And I think us trying to focus so much on like, okay, like what makes a person ace, what makes a person pan, what makes a person gay takes away from all the other beautiful things we could be paying attention to instead.
Or what makes a person straight.
Or what makes a person straight, because not all animals are straight either. I think that biology question left when they figure that out. So yeah.
Great. Okay. Any book, article, paper recommendation about consent topic and all the different aspects of it? So anyone have a good book on consent? I know Ace has a chapter that touches on it. Angela Chen's book, Ace.
I don't know. I use that tea YouTube video on consent. Have you seen where they're like making the cup of tea? That's my go-to. Most of my books are for children and teens. Unfortunately, there aren't that many for adults, which I think we need to question that because adults really don't know what consent is a lot of the time. So mine are more geared towards like children, and I can't think of them all at the top of my head.
He is for consent. Yeah, is a children's book.
Consent. I like using the T. I mostly have to. I wrote my little blurb myself, and that's what I talk to people. I actually go towards like BDSM negotiation work for mine because they're actually, if it's true, not like 50 Shades of Grey, but like true BDSM, they're actually really good at that. If they're in the healthy BDSM, so I tend to go there. I don't know, Aubrey, if you have or anyone else has more.
There's a website called Wheel of Consent that goes into a lot more detail of it. They have an entire program teaching on consent if anybody wants to really get detailed on understanding consent. Yana, CJ? No resources? Okay.
Yeah, there are just so many out there. And some they usually, I find, not that everything is missing a little piece because you can't cover everything. So just whatever you're looking at, just be mindful that there's probably something missing because there's always something missing.
Yeah. Another great website that I highly recommend is Scarletine. So that has some really good talk about consent too. What are your thoughts on QPRs? My thought is it's a relationship model amongst many others. Anyone?
Here, I just agree with you. So basically, I don't have separate thoughts on that, as I don't have separate thoughts on any other relationship models. If you're fine with it, if it inspires you, makes you happy and everyone involved, great for you.
I had brought this up, so I'm just gonna. So the terminology of queer platonic relationships came out of a context of people not having the language to express non-normative relationships of a particular kind, and it was always an umbrella term. It's not a particular relationship model. It's not romantic,
Right.
and it's not adequately or properly described by current ideas of friendship, even though it might also be a friendship, but it's anything else. So that's a lot of territory. It's not a model. It's an umbrella term for everything else, but that's
fair.
where it started. But the ways that people are using it now are often not. Like I've seen people use it as romance light, which I just cringe, and I see people use it as, look, it's the arrow version of our assimilation of we can look like everybody else and have our monogamous partnership. It's just an aromantic one. It's like, oh, no, please, no. That's not why we created these terms. That's not why we're using these terms. And so it used to communicate to people that you do not understand what these relationships are doing for me. And because they are not within your expected categories, now if I were to use that, people make all sorts of assumptions that they think they do understand. And so it's not helpful for me anymore. And yet I'm still sort of fighting to reclaim it. But I'm one of the old timers in that. I think there's a lot of possibility for non-normative relationships, and that word was an attempt to sort of claim and articulate some of that, and the restricting of that to fit it into the categories. And that's not just on ACEs, that's on like our broader neoliberal context of trying to fit everything. And it's sort of the appropriation of our terms to fit them into what's less subversive.
In a LGBTQIA plus group in my university, someone asked if someone should look for psychological advice as additional help to identify themselves as ace-aro. What do you think about that? I think one of the great things about asexuality and aromanticism is the taking agency of your intrinsic awareness of yourself. And that's not something anybody can diagnose in you. It is your journey.
Well, I think everyone should go to therapy at one point. That's just my view. But if, let's say you are curious, you're trying to figure out who you are, your identity, maybe not just your, sexual identity, but just who you are. I mean, you can go to a therapist or a psychologist for that too, right? To help, that's the support. Make sure they are LGBTQ plus or IA plus knowledgeable, because it's just not affirming. I'm going to say it again. A lot of therapists are just clicking that box because they feel like they need to. Really do your research on your therapist, and that's something, like, I'm curious and it is something I want to talk about. Then we can provide a safe, I'm going to air quotes because we can't tell you what's safe or not, place for you to explore that identity, and maybe some ways to help you explore in a safe, consensual way, make sure, all that stuff, answer questions you may have, right? Therapists may have to put on the sex educator hat for a bit if they're hopefully knowledgeable. So again, there's no problem if that's what you want to do. If you're coming out and you're like, I'm ace, this is who I am, and someone says, oh, you need to go to therapy, which I've actually gone in from my marriage family therapist professors to me, that like, oh, are you going to therapy? Are you making sure you're getting that all checked out? Then no, you don't have to go. But if it's a space where you just want to like really, identity and having that space, then there's no problem with doing that.
Yeah, I'd like to see people say that to every single person who identifies as straight. Are you sure? Have you been to therapy to help you explore that? And I actually think it would be more important for all the straight people to go to therapy to make sure that they're really straight, because so many later on find out that they're not.
Okay. Tips for a monogamous romantic relationship between an ace and an allo regarding sexuality. I think we've touched on this in a number of different ways. Does anyone have anything additional to add to this?
Oh, well, I do recommend therapy, as Destiny said, to everyone. If you feel that you're struggling with communication, because it's been said again and again, but I know it's a commonplace, but communication is key. Communication is what makes or breaks any relationship, not just a mixed one. But if you feel that you're struggling with communication, if you feel that your communication is more fights than something productive, definitely find a therapist, because mixed relationships, monogamous mixed relationships can be very happy. It's a possibility. Many people have that. Just don't believe to all the aces in monogamous mixed relationships, don't think you need to suffer to make it work, because you don't. If you need help maintaining intimacy, building this relationship, please find a therapist.
Yeah, most couples come to therapy regarding sex and communication, and I mean it's a couples thing, and I think that it's a couples thing. But yeah, if you want, again, knowledgeable to talk about that and maybe have to do some psycho ed with both partners, because there could be a miscommunication thing. But if you're wanting to be in a relationship and you're struggling, I mean, all my couples have issues regarding sex, regardless of their orientation, right? Because we're actually getting told really unhealthy sexual education from a young age, and romantic information from a young age. So of course, they're coming in for a myriad reason, but that tends to be one of them. But communication, consent, all that fun stuff we kind of already touched on. But sometimes having a mediator or a safe space to have that dialogue can help too.
And I'd like to add just a bit. There is this illusion coming from somewhere in the culture that two allos in a couple kind of intuitively can make it work. No, in so many cases, no, they need therapy. Many people need therapy, no less than people in mixed orientation couples, because we don't know intuitively how to communicate about sex, especially. So that's where and I'm guessing Destinie's belief that everyone needs therapy comes from, because, well, that's from experience with Ace-allo, and whatever kind of clients. We don't intuitively know how to make relationships work, and we don't know intuitively how to make life work in a good way for us. Sometimes we can figure it out ourselves with a lot of work. Sometimes we need help. That's it.
And I just like to add, like, as with all kinds of relationships, there's also the possibility that even if you do go to therapy, even if you do communicate well, that it still might not work. And that's okay too. That it's okay to end or change a relationship. And lots of relationships, regardless of whether there are aces participating in them or not, are still going to end and are still going to change. And that's okay. And that's part of interacting with people too.
Yeah, I mean, as a couple therapist, I've done breakup sessions. And I also want to be clear that some of my couple sessions are between friends. So, right, it's not just because I call it couple because there's more than one person, but sometimes they're coming in because the same, not maybe sex might not be a part of it. Could be, they could be feeling some sexual attraction, but there's the same issues happening with a friendship as well. So we've done couples therapy with friends too. So, I mean, it's communicate all the things that Yana was talking about.
Request here to drop your social media accounts in the chat. Okay. And then while y'all are doing that, what is sexual desire, and can it be possible to experience it as an ace? And similarly, another question, what does sexual attraction feel like? So maybe Yana can tell us what sexual attraction feels like, because I think she's the only allo here.
Oh dear, actually on the Avon forum, we get asked that a lot, and I still have no idea how to describe it. I've tried many times, but it's something so much part of me. It's like I won't be able to explain how I see color to people, to a person who has never seen that, or how I hear to a person who cannot hear. So, and I'm guessing that a person who has perfect vision, unlike me, would not be able to explain how they experience it to me. It's just something that is part of me. And I'm sorry, I've tried, I failed miserably.
Well, I can tell you I've asked this question a lot. The answers that I've gotten that, so an intense urge to have sex with another person, like a hunger, there is usually some element of heat involved in the answer, like an internal heat. And what was the other thing? Like an intense focus on that person, and intrusive fantasies about sexual activity with them. That's some of what I've gotten on that question.
But it doesn't necessarily mean that somebody actually wants to have sex with that person. Like you can feel sexual attraction and still not want to have sex with somebody.
I think this is where the main miscommunication happens, where Yana's like, it's hard for us as Ace to explain like how we don't feel sexual attraction to someone who feels sexual attraction, and someone hard from who experience sexual attraction, like to explain it to someone who doesn't. And that's where I think even within like, I think some pushback from the LGBTQ, because, you know, pansexual, gay, they all have that sexual attraction piece that we as Ace don't. So there was, I mean, from my perspective, I don't see CJ, there was some pushback that's like, well, what do you mean? Because there was still within straight too, there's still that in common. But I think it's just finding, if we haven't found the language, maybe there isn't even a language for it that exists. So we do the best we can with the language that we have. And again, the communication piece, but that's where I get like, what do you mean? And then trying to explain it. So I do the cake thing. Like I do the cake one. I'm sure you've heard the cake one. And I've talked about, like, for me, it's like almost talking about like the weather. It's that unimportant in my life. It's really like small talk about the weather, but that's where I think some of these things happen, is it's there might not be language for it yet, or if there ever will be. So how can we communicate with the language we have?
Which is also really interesting from the pushback, because I've seen sort of zines and snapshots and historical documents from the from the 60s and 70s, where asexual people are clearly part of the community and participating, and that is just, there's no pushback there. But that was before sort of this, the language of attraction is very new. Like the way of framing things in terms of attraction is very new, and that has very particular functions politically as well, because it changes things like homophobia and heterosexism that we used to be able, and we used to be talking a lot about how those impacted not just our internal experiences of who we're attracted to, but how we do relationships, how we navigate the world, our, you know, political affiliations, our social affiliations. And terms like lesbian were always much broader than just who you're attracted to. They were about how you do relation, like all of these things. Gay was always much broader. The language of trans stuff, again, was never about attraction specifically, but that's, again, all of this language landscape has changed. And as we're seeing now, the focus on like internal experience of, often the word involuntary is thrown in there, involuntary attraction. That's very much through sort of the neoliberal norms of what is considered acceptable in a moral framework, where if it's involuntary and internal and you're not making a choice, then it's okay. And if you're making a choice, relationships are things you can choose, actions are things you can choose, how you navigate, those are things you can choose. So those can be morally suspect. So this focus on attraction is serving a very political function, and that is leading to a lot of these other consequences that, while there wasn't an ace community way back then, there were ace people. And there were people naming this and claiming this and participating in those spaces back then as part of an integrated whole. Same with, there were bi people. I'm not saying that there was never biphobia, but bi folks were part of those communities and spaces then, and didn't face a lot of the rejection that is happening now, which is not to say that there wasn't any biphobia, but it looked different and it had a different function then. So these things are changing with our political landscape.
And I think that's actually the end of the questions.
Okay, so I have Stella on the phone.
Can all of you, Can all of you hear me? Okay, Destiny was kind enough to call me on the phone. So I sincerely apologize for all my tech issues. I wish I could show you how much of a shambles my Zoom is. I literally all of a sudden was only able to see the people talking, but none of the chat, none of the functions, it's pretty hilarious, but unfortunately tragic for being a seminar host. Before I do the conclusion of the event, I just did one question that was I really wanted to add my own thoughts onto that I was passionate about was the QPR question, because I have a group chat of fellow aromantic and asexual people that like, they're just my friends now. They're mostly younger than me. As 21, I'm pretty much the oldest of that group. And one of the things that they were a little shocked when I said was originally like that I use the term that I'm also, in addition to like sex and romance averse, I'm also QPR averse, which I mean I'm just like uncomfortable with using the term QPR to describe my relationships, even when I do have things between those boundaries. Just because I feel like, yeah, in nowadays when people and even fellow people that are on aromantic and asexual spectra, they now see QPR often as that like monogamous coupling, but just in a different way. And to me, I cannot identify with that in any way. So it's not obviously that I do feel that there are relationships that I have that transcend the like different concrete boundaries. But as CJ was sort of saying, like, I feel like I can't use that term for my experiences given the way it's like currently been adapted, and that I would theoretically want to reclaim it, but it's a term I'm currently uncomfortable with because of sort of the direction it has taken. And that was just one question that I so badly wanted to speak on, that I'm like a little bit backtracking now because I realize it's easier to do this phone thing only once. But yeah, so that was just my perspective. Also, if one of you could please drop my Insta in the chat, that would be great, because my chat also does not exist anymore. And yeah, aside from that, I just wanted to thank everyone for attending this Ace Week seminar so much. I really appreciate all of you. I think before my Zoom died, there was like 60 something members in the audience as like the last I noticed before everything kind of blew up. But yeah, I hope you either had the opportunity to learn a lot or feel more connected to the ACE community and just gain a lot of new knowledge from this experience. As someone said in the chat earlier, if everyone learned one new thing today, that's A+. So yeah, this was actually, I wanted to say, my first ACE week as an ACE and Arrow person. So I took a pretty big step to like not test the waters for myself, but jumped into facilitation, but it was something I really wanted to do. So I do appreciate everyone who took the time to be here today, and especially the 4 incredible speakers who had very insightful thoughts and answers to your questions, and also did a miraculous job of filling in for my technical mishaps. So yeah, definitely you already asked for our social media, so feel free to reach out to any of us through that at any time. And I am really like existentially concerned that this recording is not going to work out because my entire laptop is a disaster, which was what I feared a little bit in the first place. But if the recording survives, I will update you on my social media with how it will be made publicly available to share with either fellow people who are ACE or Arrow or fellow health service, etc. providers. So once again, thank you very much for coming, and I hope you learned a lot and enjoyed. And yes, I appreciate each and every single one of you. Have a great rest of your ACE week. I also literally cannot exit this meeting without like force shutting down my computer, so yeah, if everyone can casually mosey on out, that'd be great.
And thank you so much, Stella, for organizing this.
Thank you, Stella.
Bye.
I'm gonna hang up now.
I see how come up it's been working.